Water covers over 70% of the Earth's surface and is vital for all known forms of life. The rivers and lakes provide water to the fields and gardens. In the human body, the circulation is vital for all the organs and systems. The prevailing majority of serious diseases are those affecting our circulatory system. One of the most common pathological conditions of the circulatory system is a disease called venous insufficiency. It affects over 80 million people in the United States alone. Studies also show that, in one form or another, it affects almost 60% of women over 60 years of age. The most common complications of venous insufficiency include trophic ulcers, thrombophlebitis, or formation of potentially dangerous blood clots, bleeding from ruptured veins, development of swelling, also called edema, and different types of infection. Contractions of the heart propel the fresh or oxygenated blood through the blood vessels called arteries. A different type of blood vessels, called veins, bring the used or deoxygenated blood back to the heart. It is easy for our arteries to bring the blood downstream to the legs and feet. It is, however, much harder for our veins to deliver it back up against forces of gravity and with no assistance from the heart. To resolve this problem, we are built in a way that our leg veins outnumber significantly the arteries of the legs. Besides, each vein contains hundreds of tiny valves allowing the blood to flow in only one direction, upwards, without letting this blood to go downwards with the forces of gravity. It is well known that venous insufficiency develops due to a combination of two factors. The first one is the presence of hereditary predisposition, affecting elasticity of the venous wall. The second factor includes certain external, usually chronic conditions, causing elevation of intravenous pressure. Activities requiring prolonged standing or habitual heavy lifting, obesity, and multiple pregnancies are just some of these factors. Due to mentioned factors, veins eventually become wider, creating gaps between leaflets of their valves. The blood in such veins, therefore, moves downstream instead of going upstream. As venous insufficiency progresses, the downward flow of the blood builds up pressure in the affected veins. This pressure dilates these veins, allowing even more blood to go down, which increases the pressure further. As the veins stretch across, they also stretch along, becoming not only wider, but also longer. This is why people affected by venous insufficiency develop varicose veins, large, bulging, tortuous veins on their legs and feet. There are numerous serious complications of venous insufficiency. The most common ones include edema or swelling, trophic ulcers, different types of infection, bleeding from ruptured veins, and formation of dangerous blood clots, known as thrombophlebitis. The most common symptoms of venous insufficiency are the following: slowly developing heaviness and tiredness, as well as weakness in the legs, affecting ability to walk and, even more so, the ability to stand. Often, different types of discomfort, like alternating deep dull aches, is reported by people suffering from venous insufficiency at the early stages of the disease. Muscle cramps, also known as spasms or Charley horses, are another one of the early symptoms, as well as a condition called restless leg syndrome. Enlarged bulging veins or small tortuous bluish veins, known as varicose veins and spider veins correspondingly, are yet another symptom of the disease. As the disease progresses, swelling, numbness, perception of coldness or burning, as well as many other ones, join the clinical picture. There are different mechanisms responsible for the development of different symptoms of venous insufficiency and its complications. Swelling or edema, for example, forms due to the following. Under high pressure, the wider the affected veins are, the thinner their walls will be. The thin venous walls allow the water contained in the blood to leak into the surrounding tissue. Accumulation of free water in between the cells of the soft tissues of the surrounding veins is called edema. Additionally, the blood leaking downstream is the used blood. It contains no oxygen, a significant amount of carbon dioxide, lactic acid, and other so-called end products of our metabolism. Under these circumstances, our tissues undergo so-called trophic changes with eventual development of complications, including trophic ulcers, thrombophlebitis, bleeding, infections, swelling, and even malignant degeneration, development of skin cancer. Another common complication of venous insufficiency is called thrombophlebitis. It occurs when the already turbulent flow in the unevenly enlarged veins leads to the development of the stagnant areas, where the blood becomes almost motionless and, therefore, prone to formation of blood clots. This very rare video recording captures an enlarged vein, as it is seen on duplex ultrasound during the development of thrombophlebitis. The decelerating individual particles of the blood can be seen just prior to their precipitation and formation of a blood clot. The larger the varicose veins, the thinner their walls, the higher the pressure of the blood inside these veins, and the more likely they are to rupture and to cause bleeding. Under the pressure, affected veins stretch in all directions, becoming wider and longer. Such enlarged, bulging, tortuous veins are called varicose veins, or varicosities. Commonly perceived as a disease, varicose veins are, however, just a symptom of venous insufficiency. The identical process in the smaller veins, also called venules or venous capillaries, leads to development of the spider veins, also known as telangiectasia. Usually spider veins do not cause any trouble or remain asymptomatic. Occasionally, however, just like varicose veins do, spider veins too can rupture and cause significant bleeding. When enlarged to an extreme degree, these spider veins are called veno-venous malformations. Due to substantial risk of bleeding, it is mandatory to treat such lesions as soon as they are discovered or have developed. Edema of venous insufficiency, being often wrongly perceived as edema related to congestive heart failure or renal insufficiency, and is incorrectly being treated as such with, for example, diuretics or water pills. Diuretics are, however, contraindicated, since the edema of venous insufficiency is caused not by increased water retention, but rather by the abnormal distribution of this water in the body. As venous insufficiency progresses, not only does the water leak into the tissues causing swelling, but also the blood cells escape through overstretched walls of the affected veins. Hemoglobin released from the trapped blood cells gives the skin its brown discoloration, so typical for advanced stages of the disease. With the development of swelling, significant amounts of stagnant fluid accumulates in the soft tissues surrounding the affected veins. Retained fluid contains highly concentrated end metabolites of physiological degradation and therefore readily attracts bacteria, leading to the development of infection. Under the above circumstances, a smallest lesion of the skin over the affected veins can lead to development of a trophic ulcer due to, first, increased amount of fluid coming through the wound, and second, due to abnormal nutrition of the tissue responsible for healing. An ulcer untreated for prolonged time is likely to undergo malignant degeneration, in other words, to turn into cancer. Venous insufficiency is a group of slowly developing, serious diseases with potentially devastating complications. Fortunately, achievements in contemporary medicine and technology made it possible to successfully treat and often cure venous insufficiency. Early diagnosis and aggressive treatment are the key factors to success of such treatment.